Olá, meu nome é Renato, estive recentemente em São Paulo na Jornada Paulista de Radiologia em parceria com o RCNA, os maiores eventos de radiologia e diagnóstico por imagem, e lá tive a oportunidade de conversar um pouquinho com o Dr. Eric, médico, chefe do Departamento de Medicina Nuclear e PET-CT do MD Anderson, no Texas, Estados Unidos, os maiores centros de oncologia do mundo. Lá falamos um pouquinho sobre PET-CT, PET-Ressonância, perspectivas de novos traçadores, foi bem interessante. Acompanhe.
What's your opinion, because in Brazil don't have PET-MRI, what's your opinion and what's the impact of PET-MRI in your opinion?
So I think we still have a lot to learn about PET-MRI. The way I look at PET-MRI there are various levels in which it can impact patient care. And at the very fundamental basis, if you can show that a PET-MR scan is equivalent to a PET-CT scan in terms of diagnosis, staging, characterization, then you can supplant the PET-CT with a PET-MR and essentially get the same information at a much lower radiation dose. So you can obviate the need for a CT scan, perform the PET-MR with lower radiation exposure, and get the same information on that patient. And that's where in pediatric hospitals there's a big demand for PET-MR. So some of the first adopters have been in the pediatric population where a patient who's 6 years old, 8 years old, 10 years old, you want to avoid as much radiation as you can, maybe less critical in an 80-year-old or a 90-year-old. So that's one level. The second level would be to really utilize the added soft tissue characterization of MRI to improve your diagnosis on PET scan, and likewise use PET scan to improve your diagnosis on MRI. And the way I think about that is to look at the cases where we would preferentially use MRI for staging, and then to say perhaps PET-MR would be better than PET-CT. So things like prostate carcinoma, things like the gynecologic malignancies, cervical cancer and endometrial carcinoma, rectal cancer. It can provide a level of anatomic detail that will complete the staging of that patient at the same time we perform the PET scan. The final level will be to really leverage the additive information of PET-MR and come up with a creative way of gaining the most out of the two studies. And I'm not sure that anyone knows what that's going to look like at this point. One example perhaps would be in the cardiac field, where we know that cardiac MRI is a very powerful imaging technology. Cardiac PET is also very powerful, but is limited by motion and things like that. So you can actually use the MRI scan to detect cardiac motion and do cardiac gating, and then gate the PET data and perhaps modulate the PET information to get better accuracy of information about the distribution of radiotracer within the myocardium. So that's an example of something where you're really leveraging what MRI can do uniquely versus what PET can do uniquely to come up with a solution that's better than the two of those individually. The same has to be true in oncology, but it's not clear that we've reached that level yet to really understand how to make the most of those two technologies. But nevertheless, at each of those stages, we are taking a small incremental step forward in the evaluation of our patients. And so I think all of us are very excited about PET-MR and are kind of waiting to see where it will lead us, but we're still very early in the implementation and waiting to see what sort of impact it's going to have on patient care.